All right. So today we have a fun topic. We always have fun topics. Every month, if you didn't know, if this is your first time watching one of these videos, welcome and hello. My name is Paige Chachovka. I'm an international board certified lactation consultant. I am working with JANS, providing you accessible lactation education online and through a couple other fun things we do. We also have a free pick your pump appointment. So if you are a pregnant mom or you just had your baby and you have not already gotten your pump and you would like to talk through some of those options about which pump is best for your specific situation, you can have a free appointment with me to go over those options and help you decide which pump meets your needs specifically. So that is a fun thing we are doing here at JANS. And another piece of information, announcement, if you will, prior to getting into this. One of the things I wanted to clarify is with JANS, we are working with providing online lactation education and providing those pick your pump appointments to help you start this journey. We are not quite integrated where JANS is not providing lactation counseling at this time. That is something we definitely want to incorporate, but it's not quite available at this time. So if you're looking for lactation support counseling, you can still get that through me. That would be through me in my private practice. It's called Nurturing Lactation. And just to throw in a little bit of information, because we got a couple of just questions about insurance coverage, so I wanted to just share a little bit of that. Currently, TRICARE Overseas, I am unable to network with TRICARE Overseas. I am an IBCLC. I do not hold any other credentials outside of being a lactation consultant. And because the new demonstration project, which allows increased coverage for doula, birth care, and lactation support, that is going on in East and West regions, but it has not touched overseas yet. So because of that, they're still in their old policies, which states you can get lactation counseling covered if only done by an authorized provider who holds some other medical credentials, such as medical doctor, registered nurse, etc. And again, I'm only an IBCLC. Not only, IBCLC is a big thing in itself, but because of that restriction, I cannot offer moms any insurance coverage because it goes against the lactation coverage policy for the overseas location, unfortunately. But that should change starting 2025. Now, if you are a civilian family overseas with Blue Cross Blue Shields, Aetna, Cigna, those insurances reimburse fairly easily. So the way that you go about getting insurance coverage for that is you would first contact your insurance and ask them to give a confirmation and authorization for you to receive lactation counseling out of their network. And then you would let me know that this is your insurance. They said it's okay. We will have our appointment. You will pay out of pocket. I will give you a super bill, and then you give that to your insurance. Within 30 days, you should have that money you paid out of pocket reimbursed back to you. So there's a little bit more coverage for the civilian insurances. Now, when you're talking about in-state TRICARE, East and West, it's much different. So this little clip is just mostly about the overseas policies and the insurances that we have here. So that's our little announcement. Now let's get into our topic. So today we are chatting about our Medela hydrogel pads. It's called the Tender Care Hydrogels. I really love these ones. These have a very special place that I really recommend for all moms to get. The best time, in my opinion, pretty much for all moms, the best time to use these is in the first 2 weeks after you have baby. They are incredibly soothing. They are incredibly helpful. So basically what it is, it's meant for soothing. It is meant to provide your nipples with relief. So when you first have your baby, your body, your nipples are going to go through a lot of hormonal changes after that delivery. And that is going to cause some level of soreness with your nipples from the hormones alone. Now, breastfeeding, I often say breastfeeding is a team sport in which neither players quite know how to do it. So there's a learning curve for both you and baby, and sometimes that can cause sore nipples. So this is a great item to have on hand for that first transitional phase when you guys are just getting started. You are prone to soreness, tenderness, and the latch may not be the best as it could be. Now, this is not if you have cracked nipples, bleeding nipples, nipples that make you cringe in pain even without feeding or the entire time feedings. These things are not going to fix that. That is essentially a shallow latch of some sorts. Either you're pumping, something going on with the pump, or something going on with the latch. This is not going to fix that, but it should provide some relief. But I do not recommend to put this on nipples that have an open cut. So if there's a scab, you're okay. If there's an open bleeding cut, I would not use this. If you're in a situation where you do have excessively painful nipples and bleeding, cracking, please work with a lactation consultant so they can help you resolve those issues before they get any worse. So, just a couple air of cautions. The way that you use this, essentially, these are good for 24 hours. So you're not going to use them, for days on end. I would say, I would personally recommend to have enough for a week or two. So that would be at least somewhere between 7 and 14. Of these, they come in packs of 4. They're pretty cheap. They're about $8 at Jan's. So pretty affordable when you think about all the relief that they can provide you in that week. So the way that you would use it is you would, I'm sure you guys can hear, we do live on base at Swingdallum, so you can hear the airplanes. It is 3 o'clock and they are doing their work here. So when you want to use this, so it has a little bit of a plastic film, and don't throw this away, you're going to want this later. So remove the hydrogel pad and put your liner down somewhere you can find it again. And the directions do say to run it under some water, cold water for a little bit, just because it is very sticky. It will reduce some of the stickiness. And then attach it to your nipple and let it hang out. There's no time frame. This can only be on for 5 minutes, 20 minutes, an hour. Just stick it on. I would recommend to have it lay as flat as comfortable, but we all know some nipples are pointier than others, so however you can stick it on, as long as it's on your nipple and areola area, you are good. So you'd have this on in between nursing sessions. It may leave a sticky residue, and that's okay. When you take it off, just rinse your breast with some warm water. You can splash warm water or take a washcloth that has warm water and then remove the stickiness, and then go ahead and pump or breastfeed however you normally do. And when you take it off, you would then put it back on the sticky liner, because you can use this for up to 24 hours. So it's not just one and done. You can reuse it for the rest of the day. So try to keep track of that stickiness, or sorry, keep track of the clear liner so that you can reuse it later on in the day if you need to. It works because it is a gel that helps soothe and help. It's mostly meant for soothing, and when you have soreness and expected tenderness, that is a great thing. It is soothing, hydrating. A lot of moms complain in the early days that it feels like their nipples are dry, and so they'll see like skin kind of chafing a little bit, like a dry spot. So this can provide hydration, and the gel is cool and soothing. So those are good things to have, especially if you are struggling with latching and you just kind of have some leftover soreness, not damage, not significant pain. It can be helpful. One of my favorite tricks that I like to use these for is actually go ahead and take the entire box and put it in your refrigerator. Not your freezer, but your refrigerator. So when you put it on, and it's cool. Yes, Krista, that is definitely something that you can use instead of lanolin. It's entirely up to you. Lanolin can be good. Basically, most nipple creams are essentially nipple lotion. They're meant for moisturizing, hydration. Um, it depends on you and what you prefer. Some moms really like the thickness of lanolin and nipple butters. They like the thickness. Some moms like the constant soothing of basically gel, especially if you can get it cold first, and if you're kind of having frequent soreness in the first week, this might be something that would be suitable for you. I know personal experience here when I had my baby, he's now 2. These were a huge lifeline. Just with the soreness, your nipples, the hormones, everything is changing. You are at a very high predisposition to have soreness. Baby doesn't quite know what they're doing, how to latch well. So this is something that I really appreciated as even a second time mom, even a lactation consultant at that point. I still needed a little relief. So that's one thing I like about these. Now, again, they're not going to, if you have the excessive pain, if you have crack damage, they're not going to fix what's wrong, but they might help soothe it, make it bearable. And again, if you have those issues, definitely work with a lactation professional of some kind to help you figure out those. Oh, I do like the Earth Mama organic brand. Some moms really like the lanolin. It's very common. It's given at most US based hospitals, I believe. I didn't like how thick it was and it would stain clothes. For the lanolin, I personally, if I felt like I needed something to heal my nipples, because lanolin it's moisturizing, it is essentially lotion, and it does something like this. It's just a cream rather than a gel pad. It's the use is very similar. If I was in a situation where we had crack, or if I was seeing a mom who had crack persistent damage, something of the sort, and they needed help healing, I would highly recommend a mom to use Meta Honey Gel. That is my favorite nipple cream that has properties to help aid in a faster healing and anti-inflammatories, antibacterial. So that's something I also recommend for all moms if they find themselves having damaged nipples that surpass the feeling of like touching a bruise. If your nipples hurt more than what you would feel with touching a bruise, that is likely damage and not normal tenderness. Tenderness is okay, pain is not. So just a couple of things for you guys to think about it. Thank you so much for chatting with me, Chris. I really appreciate you engaging with me. If any of you mamas watching this here now or later on, if you have any questions, you guys are always welcome to reach out to me or any of your Jan staff for any breastfeeding related questions, pump questions, you name it. Whatever the question may be, we are here to help you. Yes, so I would definitely use the Meta Honey Gel. Sorry, and I'm responding to Carissa here. So I would use the Meta Honey Gel in place of lanolin if you are having excessive pain and damage, because lanolin is, again, a moisturizer, whereas Meta Honey Gel, because it is made of 80% of, I might say the name wrong, Manuka, one of the two. It's a clinical grade 100. It's a 100% clinical grade pasteurized honey that is known for its antimicrobial properties, anti-inflammatories. And when you use the Meta Honey Gel in conjunction with moist healing wound methods, you're going to see a significantly faster rate of healing for your nipples that can help you return to comfortable breastfeeding faster, which is why I like it, because the healing rates of Meta Honey Gel compared to an average petroleum-based nipple butter or cream such as lanolin is very significant. So I would personally say yes, I would choose Meta Honey Gel over lanolin. But again, that is also something that kind of depends on you and what you like. Do you like a gel? Do you like a cream? Do you like something else? It's there's lots of different things you can do for nipple healing and care. I'm sure in the next coming weeks I will do a video all about nipple care, nipple healing as well. Goodness. Oh, sorry. I think I'm backed up on a couple of your comments, Carissa. So the same with this. If you're using nipple cream, nipple gel pads, honey, you name it, you would, if you have a thick layer on your nipple, I would definitely go ahead and rinse that off prior to nursing or pumping. And I know the Med Honey gel can sometimes leave a like sticky bitter flavor. It's okay if baby comes in contact with it because it's clinical grade, so there's no risk of botulism, right? That's a big thing about babies and honey. So it is pasteurized, heated, and assured and safe. So that's one thing some moms think about versus this lanolin is the honey thing. But with all things, I would definitely go ahead and wipe off whatever product you're using prior to nursing. I'm sure they are all safe if they were consumed, but just to err on the side of caution and probably flavor, texture, I would wipe it off. And then once you're done pumping or nursing, reapply is something I would recommend. Okay. Well, I'm going to hop off here. Thank you guys for joining me. If you guys have any other questions in the future, we're always here, happy to help. Thanks for chatting with me. Bye, guys.